is Benjamin Appiah. My name is Benjamin Appiah. I'm the country manager for Hoffman Laboratories. Hoffman Laboratories is a leading pharmaceutical product based in France. We have over 22 branches, and Hoffman Laboratories is the company behind the very popular Vivagest, which is already present in most countries and which will be introduced in Ghana very soon. Today, I'm very happy to have our first nutritionist, who is also a dietitian, registered dietitian, who is going to lead us in a very important topic. He's going to take us through how we can use nutrition to manage PCOS and also hormonal imbalance. Hello? I hope you can hear me.
Yes, please.
Can you hear me? Okay.
Yes, please.
All right. So without wasting my time, I would like to introduce our speaker for today in the person of Forzia to take us through this wonderful presentation. Thank you very much.
Hello, Mr. Benjamin. Hello. Hello, Mr. Benjamin. Hello.
Forzia, are you ready?
Yes, I shared the screen. I wanted you to confirm.
Is it Forzia, please? Yes,
could you see my
Forzia,
screen? Yes.
I've finished the introduction.
Okay. Hello, everyone. Good evening.
Hello.
Hello. Yes.
Hello.
Good evening, everyone.
Good evening. Good evening, madam.
How are you all doing? I believe you can all see my screen.
Yes. Yes.
Okay, so my name is Forzia Abdul-Rahman, as Mr. rightly introduced me, and I'm going to be the moderator for today's discussion on the topic managing PCOS and hormonal imbalances through diet. So when we are going to be talking about two main things, focus on PCOS as well as endometriosis. And when we talk about PCOS, basically it represents or stands for polycystic ovarian syndrome. And it's an endocrine metabolic condition where most women have an imbalance of the reproductive hormones that leads to a plethora of health issues. And it's endocrine because it affects every part of a woman's body. And PCOS not only impacts a woman's reproductive health, but it also affects her general overall well-being. And looking at the image showing on the screen right now, it's a cross-sectional view of the ovary. So you see a normal ovary and a polycystic ovary. So you see something like a string of pearls in the colored green. That is actually follicles that are fluid filled. So with polycystic ovaries or PCOS, with polycystic ovarian syndrome, you have so many cysts or follicles that have grown together and formed cysts. So it's actually not a cyst by itself, but it has to do with overgrown follicles, okay? And what happens is that it makes it difficult for a woman to conceive or get pregnant. And globally, PCOS, it affects 1 in every 10 fertile women. That leads to a greater health burden. And PCOS basically also is characterized by a woman having high levels of androgen as well as irregular periods. And it affects about 65 to 70% of women that makes them become insulin resistant. And up to 70% of women who have PCOS remain undiagnosed. When it comes to endometriosis, it's a hormonal disorder whereby tissues similar to the lining of the uterus, that's the endometrium, grows outside the uterus. So it attaches itself. You find it attaching itself to either the fallopian tubes or the ovaries. And the growth of the endometrium, which is the lining of the uterus, is heavily dependent on the female hormone known as estrogen. And estrogen is one of the two main female sex hormones. So we have estrogen and then progesterone. So the estrogen is produced by the ovaries during the menstrual cycle. And endometriosis is associated with so during the menstrual cycle of a woman, estrogen levels rise and then reach a peak just before she ovulates. And this causes the endometrium to thicken in preparation for a potential implantation or conception of a fertilized egg. And it's associated with extreme pain in the pelvic area, and it also comes with some form of discomfort. And some of the symptoms of endometriosis is pain during sex or sexual intercourse. It's accompanied by sharp, deep pain in the pelvic area. And it also causes nausea, diarrhea, and constipation. And it's also associated with infertility as well as fatigue. And sometimes it also comes with heavy period. Now, when it comes to the symptoms of PCOS, according to what we call the Rotterdam criteria, a woman should have show the three factors or symptoms to be able to be officially diagnosed of having PCOS. And the top three factors are irregular or absent periods, that is oligomenorrhea or amenorrhea, and then high levels of male hormones, which is androgen, as well as infertility. There are other symptoms such as hirsutism, whereby you find that most women who suffer from PCOS have a lot of hair on their bodies as well as their face and their chest as well. Such women also present with acne and oily skin. It's also very easy for them to gain weight, but very difficult to lose the weight as a result of the insulin resistance. And also they have issues with their fertility. It also presents, or women with PCOS also show depression, signs of depression and anxiety. And because the insulin there's an issue with insulin resistance, it sort of controls their appetite. So such women tend to overeat. And also, as I mentioned earlier on, because of the inflammation as well, it leads to pelvic pain. And if PCOS is poorly or properly managed, it leads to long-term health conditions such as type 2 diabetes, again, because of the insulin resistance. And when we talk about insulin, okay, insulin is a hormone that is produced by the pancreas. So when we eat our foods and take drinks, at the end of the day, when these foods, carbohydrate foods, are digested or broken down, it's converted into glucose. And the insulin is a hormone produced by the pancreas. And what it does is that it helps the cells in the body to be able to pick up the insulin circulating in the bloodstream so that it can be able to use that for energy. And insulin, again, is an anti-starvation hormone. So it prevents you from going hungry. It also regulates the metabolism of carbohydrates, as I mentioned earlier on, as well as fats and protein. So its primary function basically is to transport glucose that is circulating in the bloodstream to be used by the muscle, fat, and liver cells. And if you are So once the cells are able to absorb or pick that insulin from the blood, that glucose from the bloodstream, it enables you to carry out your activities as well as regulate your basal metabolism. And because women with PCOS battle with insulin resistance, what happens is that the pancreas tries to release more insulin in response to the insulin that is being circulated in their bloodstream, which is not high enough. So what happens is that the more insulin that is being released or produced by the pancreas, it sort of makes the insulin levels at that time in the blood very high, and that leads to insulin resistance. So if you have high levels of insulin circulating in your body, definitely you have issues with storing fats in the body, because if there's excess glucose in the body would only utilize what it needs at that time, and it stores that excess glucose or converts it into glycogen, which is known as fat. So some of the complications that of type 2 diabetes complications of PCOS, is type 2 diabetes as well as gestational diabetes, because also during pregnancy, your hormones are very high or they are elevated, and that also influences or affects your insulin. That causes insulin resistance. It also leads to heart disease as well as hypertension. And then there's dyslipidemia. So because of the inflammation in the body, most women who have PCOS have issues with their cholesterol levels. So it becomes very difficult. And it also leads to endometrial cancer. Now, when it comes to the nutritional interventions for PCOS and endometriosis, basically nutrition for PCOS and endometriosis is similar to nutrition for people living with diabetes. So first of all, you need to ensure that you are not starving yourself and making sure that you are eating regularly. That means that you are eating your 3 meals a day. And it's also important to note that you have to factor or be mindful of the time of day that you are having your meals, and then the type of food that you are eating. So you don't starve yourself and decide to binge eat or eat all the meals that you skipped at one meal, like put all together and eat it at a particular time. So it's best to spread out your meals so that all throughout the day you are well, there's steady release of glucose, and then it also helps to boost your metabolism. So there are times that you are supposed to have your breakfast, times for your lunch, time for your supper. Ideally, breakfast is between the hours of 6 and 8 a.m. For your lunch between 12 and 1, and then your supper between 5 and 7. And in between that, you can have some snacks that helps to cushion you all throughout the day and keeps you well, your insulin, your glucose levels at a steady pace. And also you have to ensure that you are eating high fiber foods and low GI carbohydrates. Now, glycemic index has to do with how a food affects your blood sugar levels. And there are some factors that influence the glycemic index, such as the nutrient composition of the food. So the kind of food you are eating, is it a refined carbohydrate food or is it a complex carbohydrate food? So if it's a refined carbohydrate food, basically it's high in glucose, and that would not augur well for you. So you need to ensure that the food you are eating contains glucose as well as fiber and then protein. And interestingly enough, the vegetables that we do eat are all low glycemic index carbohydrates. However, the issue lies with the fruits. So although it contains fiber, some of the fruits are known to be high in glycemic index, are known to have a high glycemic index. And we categorize the glycemic index according to low, medium, and high. So if a food has a glycemic index between 0 and 55, that means it's low. If it has a glycemic index of 56 to 69, that means it's medium. And then a glycemic index of 70 and above means that particular food has a high, is high. So something like watermelon and pineapple, those ones are high in glycemic, have a high glycemic index. So it's important that you eat them in moderation and then consume a balanced meal. So making sure that the food you are having at any point in time, that is your main meal as well as your snacks, contains all the nutrients that is required of it. So we have the macronutrients and then the micronutrients. So your carbohydrates, your proteins, fats, your vitamins, and then your minerals. So you have to make sure that at every point in time, the meals that you are eating contains all these nutrients. So if your food then again is high in sugar or it's high in refined carbohydrates, it's going to affect your insulin levels and then you have issues. And then also practice mindful eating. Now you need to ask yourself this question. Are you eating that food to nourish your body, or you are just eating the food because you want it to, you are satisfying a craving, or you want it to satisfy hunger because it's the first thing you lay your eyes on? If it's the former, that means you'd make informed choices when it comes to the kind of foods that you are supposed to eat. But if it's the latter, that means you are just satisfying a craving. And mostly when you have cravings, you crave for foods that are high in sugar and fat, which wouldn't help with your PCOS. Also, you need to limit added sugars. And added sugars, or what we call free sugars, these are sweeteners, caloric sweeteners that are added to food and beverages during manufacturing or processing. And because they contribute little nutritional value to the food, they are known or described as empty calories. And these added sugars are found in commercially baked goods such as biscuits, cookies, crackers, and the rest, pastries, donuts, and all those kind of foods. They are very high in added sugars as well as fat. And there's another thing that we term trans fat. So I'll touch on that in the subsequent slides. And then you also need to consider supplementation. So for some, research has found that 1 in every 3 women living with PCOS mostly suffer from nutrient deficiencies. So it's important that you take some supplements in addition to the foods that you are eating to be able to compensate or balance out cases where you may not be eating the required dietary allowance of that nutrient that you are supposed to be consuming. And Vivagest is a perfect example of supplements that goes to help women suffering from whether PCOS or endometriosis or fertility issues, basically. Now, at every point in time, as I mentioned earlier on, in eating a balanced meal, you need to make sure that a PCOS diet should focus more on natural whole foods instead of processed or packaged foods. So 80% of your meals or foods that you eat or your diet should come from plants. So your whole grains, you are talking about your whole grains, that's your whole wheat, rice, either the local or brown rice. You are talking about your maize. You are talking about your oats, your beans, basically the legumes. So the black-eyed beans, the kidney beans, the lima beans, the chickpeas, the lentils, and all whatnot, as well as your nuts and seeds, and then your fruits and vegetables, and then your protein, which should be fish or any other thing. If you are someone who is lactose intolerant or you have some food allergies, then it's best to stay away from dairy and its products. So focus mainly on the fatty fish because of the omega-3 fatty acids contained in there that helps to fight inflammation, instead of taking the processed foods. Now, these processed foods, like I mentioned earlier, are foods that are high in sugar, salt, as well as fat. And most of the time, the trans fat is what it's very high in. And trans fats are dietary fats that are very harmful or worse for your health. And these fats, the trans fats, are produced when liquid oils are transformed into solid fats. And it's these trans fats are not supposed to be added to food. So the U.S. Food and Drugs Administration Authority has banned the use of such trans fats in the manufacturing of foods. But it happens that it's still added to foods, although in minimal amounts, but you still find them in the foods that you are eating. And these processed foods are very high in such trans fats, as well as the added sugar. So your cookies, your crackers, your biscuits, the donuts, the candies, and all those things are very high in trans fats. When it comes to the guidelines for monitoring blood sugars in people with PCOS or even endometriosis, we focus on making sure that you are eating or spreading out your meals. So when it comes to the carbohydrates, you are taking into consideration the complex carbohydrates. And the lower end of the lower end figure, which is 30 grams, is for people who are obese or overweight. So for them, they do not have to consume too much carbohydrates because that would increase their caloric intake. But for, some of the misconceptions people have is that all women with PCOS are obese or overweight, which is not true, because PCOS affects women of all sizes, whether you are of a normal weight, whether you are overweight, whether you are obese or even underweight. So it affects women of all sizes, not just women who are obese alone. And also PCOS. And so because of that, if you are overweight, you're overweight or obese, your focus should be on consuming 30 grams of carbohydrates per meal. Also, that equates to about a serving or almost 2 servings of carbohydrate, depending on the kind of food that you are eating. So for example, if you are having, depending also on your activity level as well, because if you are someone who is sedentary or the nature of your work requires that you sit behind your desk a lot, then if you are eating 60 grams of carbohydrates, it's not going to help you, because we are trying to prevent the body from storing excess carbohydrates as fat. So you should focus on the 30 grams, and 30 grams of that should be about a fist size of, say, if you are having banku, a fist size of banku. But it's also important to note that eat your heaviest meals during the daytime, especially during lunch. So for breakfast, you can do something light. But if you are someone who is into a labor-intensive job, then that would require that you need a lot of energy. So you can do banku or kenke or even wache perhaps for your breakfast. But if you are someone who works in the office or has a white collar job, then you can do something light for breakfast, but then again contains more fiber. So your oats, wheat, or even rice water. And then when it comes to your snack, you should focus on consuming between 15 to 30 grams of carbohydrates per snack. And then you follow the My Plate method. So the My Plating method helps to portion the foods that you are consuming. So when you look at this slide, what you see is that you have a food pyramid to your left and then the My Plating method to your right. So the food pyramid serves as a guide when it comes to the servings or the quantities of foods that you are supposed to be eating. So when you look at the base of the pyramid, you have your whole grains or your cereals. Then on top of that, you have your fruits and vegetables. Then it goes on in that manner. Then you have your protein, animal sourced foods, as well as the animal source foods, so which are grouped in milk and milk alternatives, as well as your meat, fish, eggs, and its alternatives. And then at the apex of the pyramid, you have your fat, oil, salt, and sugar. So that tells you that a chunk of your food that you eat should come from the base of the pyramid. So when you look at the My Plating method, it's assumed that when you have a plate, but mind you, the plate shouldn't be the very large or larger size plate, but it should be a standard plate. So you assume that the plate is partitioned into 4 parts or 4 quadrants. So a quarter of that, or a quarter of the plate should fill your carbohydrates, and that's the healthy carbohydrates that we touched on, which is the complex carbohydrates. And then a quarter of it should also be your lean protein, so either your fatty fish or your poultry, which is chicken or turkey. And then half of the plate should be your vegetable. So an example is if you are eating jollof rice with so you can have a cup of jollof rice. So we have the measuring cups that helps to portion the foods that you are eating so that you don't overeat or overindulge in terms of the calories that you are supposed to eat. So a cup should be enough for you. Then that fills a quarter for the carbohydrates part. And then your lean protein, you can have a grilled fish. So with that, it can be a palm sized. So you know some of the fishes come in bigger parts. For example, the tuna and all those big fishes. So when you buy them, usually they come in cuts. So a palm size is about 100 grams, which should be enough for your protein per meal. And then the other half of the plate should be your vegetable salad. So the vegetables, so it should be like a vegetable salad without the salad dressing. And luckily, some of the plates we have some of the plates that have come already in this partitioned form. So it helps to guide you if you may not have the measuring cup at your disposal then, or you are finding it difficult trying to estimate the amount of food that you are supposed to eat. That would help you to figure out the quantity or portion of food that you are supposed to eat. And then you have your fruits in addition. Very important, because we are trying to fight or mitigate the effects of insulin resistance. So the fruits contains fiber, which would help release the glucose gradually into your bloodstream. And then you have your water on the side as well. Now, there are some key nutrients that helps with PCOS management as well as endometriosis. The first one has to do with magnesium, and magnesium helps with absorption and conversion of glucose into energy, and it acts as a pain reliever by reducing inflammation and improves mood. So when you are eating foods that are rich in magnesium, it will help relieve you of the pelvic pain due to the inflammation, and also helps improve your mood. So magnesium, aside from improving your mood, also helps to relax you and relax your blood vessels, which is also very important. And so magnesium helps with glucose control as well as androgen balance. And then the other nutrients is inositol. And inositol are basically molecules that is needed by the body in small amounts. And it's a part of the B complex vitamins. And what it does is that it improves blood sugar and insulin levels for those with PCOS, and can help with your cycle regulation. Because women with PCOS affects your menstrual cycle. So instead of having a regular flow, a normal menstrual cycle should last between 21 to 35 days. But because people who have PCOS may experience missed periods, so the periods does not come regular or as and when it should, their cycle lasts less than 21 days, or it goes beyond 35 days. So inositol helps balance or regulate the blood sugar levels, as well as helps with the cycle regulation. And it also improves fertility and also reduce the male androgen or the male hormone, that's testosterone levels. The other nutrient also is omega-3. What omega-3 does is that it normalizes and regulates the body's cholesterol and triglyceride levels, and reduce inflammation, thereby alleviating pelvic pain. So, and it also helps improve the skin from dryness. And then we also have the B vitamins, which are very important, particularly vitamin B6. And then we have choline as well. Then we have zinc. What zinc does is that is the one of the most abundant micronutrients that can be found in the body, and it's essential for oocyte division. Basically, so oocytes are female germ cells that will develop into an egg to help with menstruation. So it helps with egg division. It also helps with fertilization and embryo development. That's when, if there's a sperm that implants with the eggs that has been released through the fallopian tubes into the uterus, then it helps conception to take place. And then a deficiency in zinc disrupts menstrual cycle and slow the production of good quality eggs. So it's very essential that the foods that you eat are rich sources of zinc. And the recommended dietary allowance for females is 8 milligrams per day. Then we have choline as well. Now, what are some of the sources of zinc? And some of the food sources of the nutrients that I touched on. We have, for magnesium, we have legumes, that's the beans. We also have almonds, then the dark leafy green vegetables. So in Ghana here, fortunately, we are blessed with a lot of dark green leafy vegetables like kontomire, ayoyo, which is the jute leaves. We have shuwaka, bra, and all those leaves. And then you have your lettuce as well, which is also an example of green leafy vegetables, and then cabbages. Then we have avocado and whole grains. So your cereals, you are talking of the rice, either the local or brown rice. We are talking about the maize. We are talking about the oats. We are talking about the wheat. Then when it comes to inositol, we have whole grains again. We have nuts and seeds such as almonds, walnuts, and then pumpkin seeds. We have legumes, and then fruits. So grapefruits, oranges, all the fruits you can think of, sorry. Then when it comes to omega-3, we have the fatty fish such as salmon, mackerel, sardine, and anchovies, and then herrings. Now, what we refer to as mackerel, what we refer to as salmon in Ghana here, that is not salmon, that's actually mackerel. Salmon is those are foreign fishes that are very high in omega-3 fatty acids, just as the other ones, but just want to make a clarification that what referred to as macro, salmon here is actually macro, but it's also a good source of omega-3 fatty acids. And then the anchovies, which is the 1,000. And all these foods is when you get them, the fresh ones, I wouldn't encourage that you buy the ones that have already been fried, or with the anchovies, the ones that have been fried, because they fry it to a point where it becomes so dry and it virtually would have lost its nutrients. So you can just roast them and then prepare, instead of buying the ones that have already been fried. And then we have the nuts and seeds, such as the flax seeds, chia seeds, walnuts, and even the almonds as well. And then there are oils. So some of these seeds have been pressed to produce oil. So if either you consume the nuts and the seed itself, or using the oils, either way you get your omega-3. And then we have the B vitamins as well, sources such as legumes and then leafy greens. Then when it comes to vitamin D, so according to study or research that was conducted, it was found out that 1 out of 4 women with PCOS were vitamin D deficient. So it's very important. Fortunately for us in our part of the world, we are exposed to sunlight, so we wouldn't be deficient in vitamin D. But for those of for our counterparts in the Western world or developed countries, whereby their exposure to sunshine is limited, they would need supplementation because they are not exposed to the sunlight, which contains the active form of vitamin D. But then again, aside from sunlight, you can also get your vitamin D from eggs, from your dairy, but going for low-fat milk and cheese instead of full or whole cream or full-fat milk, because that will be high in saturated fat, and we don't want that. And then you can also get your vitamin D from your fatty fishes. And then with zinc, you can also get those ones from legumes, shellfish, as well as cashew. And then with choline also, you get them from eggs, nuts, mushrooms, and leafy greens. People who are vegetarians or vegans stand the risk of being deficient in most of these nutrients that I mentioned. So for them, it's very important. That is where supplementation becomes very important. In addition to the meals that they are eating or the foods that they are eating, they add their supplements as well. And this brings us to the end of our presentation. Are there any questions? Hello? Hello? Hello?
Hello? Hello?
Yes, can you hear
Hello?
me?
Hello?
Yes, can you hear me?
Yes, please.
Yes. So at this point, I'm open to questions if anyone has questions to ask. Or if you can also type it out in the tab, and then I would address them. Hello? Hello? Yes, midwife Sophia. Can you hear me? Yes, so someone just asked me to do a summary. So Sophia, can you hear me? Hello, Sophia. Kindly unmute yourself and talk. Hello, Sophia. Hello, Sophia. Please, if you can hear me, kindly unmute yourself and then let me know from what point
Yes.
you want me to do a recap. Yes.
Yes, I can hear you. Thank you very much. Good evening.
Good evening,
Yes, I
Sophia.
joined like 5 minutes ago. I was quite late. I was at a program, so please can you give us a summary?
Okay, so I would
Thank
go
you.
over it again for the sake of those who joined in late. So, yes.
All right, thank you.
So at the topic for the presentation today was on PCOS, how to manage PCOS and hormonal imbalances through diet. And basically PCOS is a metabolic endocrine disorder whereby it affects women in their reproductive ages, particularly between the ages from 18 to 44, and is the leading cause of infertility amongst women. And globally, it affects 10% of women, 10% of fertile women, and is characterized by hyperandrogenism, which means having high levels of male hormones, as well as ovarian cysts. And up to 70% of women with PCOS remain undiagnosed or are not even aware that they have the condition. And PCOS is mainly characterized by insulin resistance. So what happens is that for a normal person, once you eat any other, like you eat your foods, carbohydrates containing foods, when the food is broken down or digested, it's converted into glucose. But the pancreas releases a hormone called insulin that helps the cells to absorb that insulin that is circulating or floating in the bloodstream. But with people with PCOS actually are not responsive to insulin. So their pancreas releases more insulin in response to what their body's trigger. And when it happens like that, you see that they end up having high levels of insulin, which causes insulin resistance. And it's also characterized by inflammation as well as high levels of the male hormones androgen. And I touched on the signs and symptoms of PCOS, whereby women with the condition have irregular or absent periods. And you know, for a fertile woman, you are supposed to have your menstrual flow every month. But in people with PCOS, their menstrual cycle lasts less than 21 days or more than 35 days. So your menstrual cycle starts from the day of your first period to the day of the next period. So usually the cycle is about 21 days. And for menstruation to take place, it occurs in stages. So we have the follicular stage, whereby the body prepares itself to release the eggs from the ovaries through the fallopian tube to be deposited in the uterus, which lasts between the first day to the 14th day. And then the ovulatory phase, which takes place or occurs on the 14th day. Then you have the luteal phase, which occurs from day 14 to 28. So if there's no sperm to come and implant or fuse with the eggs that have been released from the ovaries, then the uterus will shed its line, like the eggs would have to be broken down, and then it comes, or the uterus sheds its lining, and that's when menstruation takes place. But people with PCOS do not have a regular monthly flow, or sometimes the periods do not even take place at all. And it's also characterized by high levels of the male hormone testosterone, which gives them features such as the excessive hair on their face, as well as on their chest and other parts of their body. And then they show or have issues with their skin, oily skin, and as well as acne. And then it's very easier for them to gain weight because of the insulin resistance, but very difficult to lose the weight. And also because of insulin resistance, it puts your body in a calorie storing mode. So it slows down your metabolism, and then that leads to most of that fat being deposited in your midsection or your abdominal area, and that's what we refer to as the central obesity. And then women also exhibit or show signs of depression and then binge eating as well. And then they also experience pelvic pain. And if PCOS is poorly managed over a period of time, it leads to long-term health complications such as gestational diabetes, heart disease, hypertension, issues with their cholesterol. So with dyslipidemia, you realize that they have high levels of the LDL cholesterol, which is the low density lipoprotein, and rather low levels of the HDL. But the reverse should be the case. It should rather be having optimal levels or even high levels of the high density lipoprotein, and then low levels of the low density lipoprotein. But the reverse happens in people or women with PCOS, and then it puts them at risk of cancer such as endometrial cancer or even breast cancer. And then when it comes to the nutritional intervention in managing PCOS, the nutrition for PCOS is this, and endometriosis is the same as managing people who have diabetes. So the advice that is given to them applies, the same thing applies to women with PCOS. So you need to eat regularly, and also bear in mind the type of food you are eating and also the time of day you are eating. So type of food in terms of, ask yourself whether the food you are eating, is it a refined carbohydrate food, or is it a food that is high in dietary fiber? That means it's a complex carbohydrate food. So there's a slow and steady release of glucose into the bloodstream. And also ensuring that you space out the food you eat evenly all throughout the day. So you don't starve yourself and then binge eat at a go, or put together all those meals and eat it at a particular time. No, you don't do that. But making sure that you are eating your meals at the required times, and then also making sure that you are pairing your carbohydrate foods with adequate amounts of protein and fat. So you make sure that if it's your breakfast, your lunch, your supper, it contains the macronutrients, that's the carbohydrates, protein, and fat, as well as the micronutrients, that's the vitamins and minerals. And also, you make sure that you are eating mindfully. So we have mindful eating and mindless eating. You know, sometimes you are stressed out, so you become emotional and eat because you eat to satisfy or give yourself some sort of comfort. You understand? But it shouldn't be the case. You have to see your food as medicine, and seeing the food as something that contains nutrients that would nourish your body and help you to thrive and flourish. But if you are eating because you are trying to satisfy a craving, most often than not, you rather crave for the wrong foods, which are very high in sugar. So either it's the carbonated soft drinks or what we call the fizzy drinks, or even fruit drinks as well as the fruit nectars. So fruit nectars are example, I don't want to mention brand, but you know sometimes some of the drinks, they are advertised or classified as 100% fruit juice, but they are not fruit 100%, actual 100% fruit juice, because anything that sits on the shelf that is on the shelf beyond 24 hours and it doesn't go bad, it's not food, it's not natural. You understand? Because if you are taking, for example, you take a watermelon or maybe a pawpaw or orange and you blend that, even in the fridge, after some time, it would go bad, right? So most of these foods or packaged processed foods sit on the shelf, have a shelf life, minimum is like 3 months. So anything that sits on the shelf without any form of, how do you call it, storage, as in either being frozen or kept refrigerated and goes beyond 24 hours, it's not healthy. And also, you shouldn't be eating foods such as fried foods, the pizza, the donuts, and all those things, because most often than not, they are high in salt, sugar, and carbohydrates. And the sugars in there are what we call added sugars. So basically, added sugars, they are caloric sweeteners that are added to either food or drinks. And they are classified as empty calories because they do not contribute any nutritional value, or they do not contain any nutrients. And the examples of such are the soft drinks, the fruit nectars, the pastries such as the donuts, the biscuits, the commercially baked goods, so the biscuit, the crackers, the cookies, and the rest. And then also we look at supplementation, because most often than not, women with PCOS are deficient in most of the key nutrients. So we consider supplementation, especially when it comes to people who are vegans, because their diet is mostly based on plants. So sometimes there may be deficiencies in some of the nutrients because they are not eating the required amounts that they are supposed to be eaten. So supplementation becomes necessary in such a situation. And then we also yes, so we also touched on the kind of foods that you are supposed to eat. So about 80% of a PCOS diet or an endometriosis diet should be plant-based. So your focus should be consuming whole natural foods instead of processed or packaged foods. And eating from the food groups, we've categorized the foods into 3 sections. So we have the energy-giving foods, we have the bodybuilding foods, and then the protective foods. So the fruits and vegetables come together to form the protective foods. Then the bodybuilding foods has to do with the protein and fats. And then the energy giving, we are looking at the cereals, the whole grains, we are looking at the legumes, and then you are also looking at the nuts and seeds. So you make sure that every meal that you have satisfies, or you make sure that your choice of food selection comes from these 3 groups that I mentioned, instead of rather going in for the processed foods that are high in salt, fat, sugar, and trans fats, because these trans fats lead to inflammation. And they are actually oils, liquid oils that have been processed or turned into solid fats by a process we refer to as hydrogenation. So example of such foods, we have the processed meats or the cured meats. So something like sausage contains trans fats, the shortenings, and then the spread. So margarine and all those things, they are not good. And what trans fats also do is that they raise your LDL cholesterol, That's the bad, what we refer to as the bad cholesterol, and rather lower your HDL cholesterol, or what is called known as the good cholesterol. And then when it comes to the blood sugar monitoring for PCOS, because PCOS women are insulin resistant or have issues with insulin resistance, you have to make sure that you evenly spread out the food you are eating. Also bear in mind the glucose. And one thing I touched on was the glycemic index. So glycemic index is a measure that is used to determine how a food affects, a carbohydrate food affects your blood sugar levels. And it's influenced by the nutrient composition of the food, its ripeness, as well as the processing it has undergone. So as much as possible, you make sure that the food that you are eating has, if anything at all, if it's undergone any processing at all, it should be minimal. So for example, so going for whole natural foods instead of the processed foods. So something like cassava, okay? If you're actually eating cassava with a vegetable stew, although cassava may have, when you are eating cooked cassava, the glycemic index is low, you understand? But the moment that cassava is processed into something like cassava flour or processed into gari, it would increase its glycemic index because that has undergone some processing. So the glycemic index changes depending on the process that food has undergone. So you have that same food, but depending on the processing it has undergone, can increase or decrease its glycemic index. Okay, so for women who are overweight or obese with PCOS, you focus on 30 grams of carbohydrates per meal, and then 15 grams of carbohydrates for the snack. But for women, then again, there are some myths whereby people think that all PCOS, women with PCOS are overweight, which is not true because you have some women who are slim also living with PCOS. And even with this, it's very difficult to detect based on their size. So if you are underweight, then that means you would have to also increase your weight because being underweight also comes or poses some health risk to you. So they would have to go for the higher end of the range. So maybe 60 grams, up to 60 grams of carbohydrates for the meal, and then up to 30 grams of carbohydrates for snack. And then also we look at the my plating method. So the my plating method basically partitions the foods that you are supposed to eat in terms of the quantities or the servings. So when you take a standard plate, okay, a quarter of the plate should be your carbohydrate food. Then a quarter of that plate should be your protein. And then half of that plate should be your vegetable. So it applies to both stew and soup dishes. So if you are eating, say, example, banku or TZ, that means a quarter of that, a fist size should be your TZ, and then a bowl. With that one, you would have to use a bowl for the soup, although it's vegetable based, but that would be a soup. So you focus on taking more of the soup than the carbohydrate, and then you pair that with the protein. So a quarter plate size of lean protein, assuming if you are taking fish, something like mackerel or redfish, that would be a whole medium, the entire size of your palm. But if it's the bigger fishes that come in cuts, that would be the inside part of your palm, excluding your fingers. So that's about 100 grams of protein. Do you get me? And then also we touched on some of the key nutrients that are essential in the diet for people to help manage PCOS. And we talked about magnesium, whereby magnesium helps with absorption and conversion of glucose into energy to be used up by the cells. It also acts as a pain reliever by reducing inflammation and improves your mood. And inositol is also helps with blood sugar and insulin, levels, improve blood sugar and insulin levels. And then it also helps with your cycle regulation. It improves fertility and also reduces androgen levels, that's testosterone. And then omega-3 fatty acids helps to normalize and regulate the body's cholesterol and triglyceride levels, and also reduce inflammation, thereby alleviating pelvic pain. It also improves the skin from dryness. We also touched on the B vitamins. We also touched on vitamin D that helps with tiredness and helps with hair loss. So women with PCOS, although they exhibit or have excess or high amounts of body hair as well as facial hair, when it comes to hair on their scalp, or which is hair on their head, the hair thins out. So it falls out, or what and refer to that as male pattern baldness. You understand? So if you are eating the recommended dietary allowance of vitamin D that you are supposed to consume in a day, it helps with the hair from shedding or breaking or thinning out. And then we also touched on zinc and then choline. So some of the sources of magnesium, foods, we have legumes, almonds, dark green leafy vegetables such as contomere, lettuce, cabbages, ayoyo, bra, and all those leafy vegetables, dark green leafy vegetables. We have avocado as well as whole grains. And then with inositol sources, food sources such as whole grains, nuts and seeds, legumes, as well as fruits. Where for omega-3 fatty acids, you can also find them in fatty fishes such as mackerel, salmon, sardine, anchovies, and herrings. You can also get them from nuts and seeds such as flaxseed, chia seed, walnuts, and also their oil. So some of the seeds and nuts are pressed into oil, so you can get the omega-3 fatty acids from either the seed or its oil. And then you can get B vitamins from legumes, leafy greens. You can also get and fish also for the B vitamins. And then for vitamin D food sources, you can get them from eggs, particularly the yolk, and also dairy. So, but with the dairy, go in for low-fat milk as well as cheese, because if it's full milk or full fat milk, that contains a lot of saturated fats, and we don't want that. So you go in for low fat milk and cheese. You can also get vitamin D from yogurt. You can also get it from fatty fishes also. And then with zinc, you can get that from legumes, shellfish. Is also an excellent source of zinc. An example of shellfish is oysters, and then you can also get that from cashew. And then with choline, you can also get them from eggs, especially the yolk. You can get that from nuts, from mushrooms, and leafy greens. So basically, it tells you that you should focus your focus should be on a plant-based diet, or your meals, your diet should be centered on plant-based foods, basically. You understand? So, Safia. Hello, Safia. Hello, Sophia.
Yes, I'm on point. I'm following you. Yes, thank you very much.
So that's the end. So if you have
Yes.
any questions, you can
I
also
think there are
ask.
questions in there. There are questions in there.
You have
Thank
some
you.
questions. Okay, so someone was asking that, just a moment. So if the person, please, my question is, if the person is able to conceive, can this condition also predispose the pregnancy to miscarriage? Yes, it can happen. And if so, would the person have to continue to be on any diet or medication till full-term pregnancy? So mostly what we do is that because of issues of insulin resistance, we focus on the diet as well as putting them on contraceptives. And for those who want to get pregnant, we would have to improve their fertility. So we put them on oral contraceptives and also metformin to help regulate their sugars, their insulin, and also control their weight. And yes, so it's a combination of both the diet and then the medication. But then you don't go off the diet. This should actually be a lifestyle or your way of eating. So it's not something that you practice and once you get pregnant, you go off track. No, you have to follow it all through. Actually, that's how we are all supposed to it. But it so happens that sometimes we go off track or we don't follow that. So yes, you have to stick to that diet. And then someone also asked, please, can you help me with something? My daughter is 16 years old and she hasn't had her menses. Please, is it a problem? Yes, it's a problem because at 16 years, usually once you enter puberty from their teens, you should have your menses. So if at 16 she's not had her menses, I believe you should report to a health facility to see the GP to assist you, okay? Or any qualified health professional to assist you. So, Madam Victoria, if you can hear me. Hello? Any more questions? Hello? Hello? Hello?
Hello.
Yes, please, any
Hello.
more question? Yes. I think I've answered Madam Victoria. So if you heard me, kindly go see a GP, a medical doctor or a general practitioner to assist you, okay? Because I believe at that age, she should have started her menses, okay? But maybe I'm not trying to raise any alarm. It can be normal because we are all different. So menstruation is different for every lady. But then again, just to be on the safer side, just go see a doctor, okay, for assessments and further review.
Hello.
Yes, I can hear you. Please go ahead and ask your question.
Good evening. Thank you for the opportunity.
You're welcome.
I'm Rebecca.
Okay.
I want to find out how long a person with PCOS will be on a contraceptive.
So you don't decide that you would be put on contraceptive. You don't decide on your own that you start taking contraceptives. It's
Yeah.
a doctor who puts you on contraceptive.
Yeah.
And he is at it is at his discretion to determine how long you are going to be on the contraception for before you are taken off it. You understand? So that's up to the discretion of the general practitioner or the medical professional. Okay, but it's advised that you are put on the contraceptives as well as the metformin.
Metformin.
Yes, and then we have the hormone therapy. So the hormone therapy involves the contraceptives to help regulate the menstrual cycle so that the person can be able to have their period.
Okay.
I understand? Yes.
My reason for asking this is in a situation whereby the person is trying to conceive and she is being put on a contraceptive.
Okay, I'm listening.
That was where I was worried. Since the person is trying to conceive.
But so the question is the person having their menses?
Yeah, yes, but not
regular.
Not
regular. So
yes.
if it's not regular and the person has plans or intentions of starting a family or getting pregnant or conceiving, then the doctor would put that person on contraceptives to help improve their fertility and also regulate their cycle or normalize their cycle. So yes, they'll be put on contraceptives.
Okay, thank you.
You're welcome. Any other question?
No.
Okay. So someone was also asking, so from Ejenunye, I don't know if I got your name correctly, but thanks for the presentation. My normal cycle is 28 days, but it has now changed after my second born to 33, sometimes 40. Is it normal? But do you still have your flow? That's the question. Sometimes, you know, as women, certain situations would affect your menstrual cycle. It doesn't necessarily prompt you, or it shouldn't make you alarmed that you have PCOS. So if you are stressed, stress can affect your menstrual cycle, okay? If you are not eating well, that means you are lacking in iron. That can also affect your menstrual flow. So perhaps the average number of days for the period or the menses, usually it's lasts between 3 to 8 days, but on average 5 to 6 days. But if you are anemic, okay, or you have low iron stores or levels in the body, it's even going to affect your cycle. So either it delays the cycle or it comes before the time it's supposed to. Or even if it does, the flow may not be what you are used to. It can be scanty. You understand? So these are some of the things. And certain medications sometimes also can delay or change your cycle. So it's a combination, or it's an array of factors that come into play. Okay. And then someone was also asking, please, what can we use to treat severe lower abdominal pain during menstrual cycle? I don't get your question clearly. Are you asking in terms of whether you can go ahead and take medication or what? But I would advise that if the pain is too much to bear, is too severe to bear, then you may take some painkillers, okay? Because, you know, there are some women who, when they are having their menses, it renders them immobile. They are not able to do anything. Some, it gets so serious that they have to be admitted to the hospital, be in bed up until they are done with their menses. So If that is the case, then of course you may want to take some painkillers to ease the pain. But for me, I would advise that you watch the kind of foods that you eat even before you begin your menstruation, because you are what you eat. So whatever food you are eating, either good or bad, will affect the body also in that manner. Okay. And Barbara is also asking, please, after age 45 years, is it okay to have dysmenorrhea? Barbara. Hello, Barbara. Barbara, if you can hear me, kindly unmute yourself. I don't really get you. Hello, Barbara. Hello, Barbara, if you can hear me.
Hello.
Kindly, yes, Barbara.
Yes, hello.
Yes, kindly. Okay, so come again with your question. I didn't really
Yeah, I
get
just wanted to find out, is it normal to still have dysmenorrhea after age 45? Because I know it's when you start in the teens, but
Yes.
for that stage, I find it difficult to understand if maybe am I the only person or others too have been going through the same?
Yes, so then again, you see, as women, although there's a general rule of principle that applies when it comes to issues of reproductive health and all that, but at the same time, we are different, okay? Although around the age of 45, you should have ceased your menstruation, but you find some women who even conceive around that age. I don't know if you are getting my point.
Yes.
Yes, so although there's a guiding principle, but you treat each person on a different, like at an individual level. You don't treat them as a group, but you treat the person as per their condition or the symptoms they present with. You understand?
Okay. Thank you so much.
You're welcome. Please, any other question?
Yes, please.
Yes. Kindly go ahead with your question, okay?
Please, I learned that PCOS cannot be cured. It can only be managed. And
Yes,
that the
that's true.
actual cause of it is unknown.
Yes, that's true.
I want to know that naturally, can a person with
PCOS.
PCOS naturally, can it be reversed without doing anything to it?
So the truth is that PCOS, just like endometriosis, like you rightly said, it has no cure. And the exact cause of what causes PCOS is not known. Okay. But if there's a routine, it follows a routine. So if there's a family history or like genetics, so if you have a primary relative who has PCOS, so a primary relative in this case is a direct relative. So for example, if you have maybe you as a lady, your mom had PCOS, okay, chances are you stand a higher risk of getting PCOS. It doesn't mean for certain that you have PCOS, but you stand a greater risk of PCOS, because there are certain situations whereby for some women there's no family history of PCOS, but they end up getting PCOS.
Yeah.
You understand? So it's different. It varies from person to person, but having a family history of PCOS puts you at a greater risk of PCOS.
Okay.
So I hope that answers your question. If you have any other questions.
No.
Okay.
Now, if one is being diagnosed of having PCOS, is it possible that a time will come and the person will not experience the PCOS again?
So when it comes to the management of PCOS, I touched on the diet, okay? But for example, if you are obese or overweight, okay, It's not just the diet alone that helps to alleviate the symptoms of PCOS, but exercise is important. So the exercise acts like a catalyst. Okay, so just even a 5% reduction in weight goes a longer way to improve the symptoms of PCOS, the severity of the symptoms. So exercise would help you to lose the weight if you are overweight or obese. You understand? And once you drop in weight, for example, maybe your BMI was 30, okay, and you exercise and the BMI, maybe you lost about 10 kg, that would make the BMI come down from 30 to perhaps 29 or 28. In that case, it goes to improve or alleviate the symptoms that is associated with PCOS. You understand? And then the other thing also is stress management, making sure that you are not stressed, you are having enough sleep or rest, because if you are not having enough stress, it also goes to affect your hormones. Your hormones fluctuate, and there's a whole lot that goes on. It affects your mood, it affects your appetite, or it increases your appetite and makes you crave for unhealthy or sugary foods. You understand? So it's a whole lot when it comes to PCOS. So yes, it's not curable, but you only learn to manage it by treating it. You understand? So the diet, the exercise, and then sleep as well goes a long way in helping in the management of the condition.
Okay.
Yes.
Okay, thank you. And I also want to, I don't know how this is going to happen, but I want to plead that you, the health workers, should, please, are you a health worker?
Yes, I'm a health worker.
You should advocate so that the treatment of PCOS will be on the health insurance, because the medication are expensive.
Expensive, yes, that's true. We'll try our best. We'll channel it to the appropriate authorities. I understand where you are coming from, because but I'm not in that position of power to. I know. But we'll channel it to the people who. So yes, your point is well noted.
From one point to get to another point. So if at your place you can voice it out to your authorities, it will move from there to another place.
Yes, I appreciate your concern. Thank you so much.
Thank you too.
Any other question? If not, I think maybe we can wrap up, and then thank you to everyone who was able to enjoy and who was able to join in the presentation or today's discussion.
All right, thank you very much. It was a very good presentation. In case you are not part of our WhatsApp group, we have the link on the chat, so you can go to the chat and kindly click on the link and join our WhatsApp group. We do this webinar every Saturday at 5. Today we have to do it at 4 because the presenter wanted us to do it because he going to be engaged. So God willing, next week we'll have another presentation which will be at 5 o'clock. If you realize that for this month we're putting more nutrition, so we're also going to have another medical doctor who is also on nutrition. So that will be on next week at 5 p.m. So we'll share all the links across all our social media on Facebook. So when you go to Facebook, it's Vivagest Ghana. When you go to LinkedIn, it's Vivagest English. You go to Instagram too, it's Vivagest Ghana. Then of course YouTube, Vivagest English. We also have a WhatsApp number, and of course a WhatsApp group that you can join in case you have any question related to anything related to pregnancy or fertility. We will be able to guide or support you, not necessarily giving you direct answers, but we'll try and guide you as to where you have to go. So thank you very much. This presentation was brought to you by Vivagest. Vivagest is a superfood supplement that aid fertility and also guide pregnant women from pregnancy to breastfeeding. Vivagest is already available in many countries, and God willing, Vivagest will be in Ghana. The FDA normal, and very soon the product will be in Ghana, so that those who need every pregnant woman, even those who want to get pregnant, can also take in Vivagest. So thank you very much. Thank you all. I know you are very busy, but have to take time to listen to this presentation. So God willing, we'll be here again at 5 p.m. through Zoom. Thank you, and nice. Enjoy your weekend, and God bless you. Bye-bye.
Bye. Bye-bye.